Thank you very much, Honorable Philip J. Pierre, Leader of the Opposition and Leader of our party. The Minister for Health, Senator Mary Isaac, confirmed on Timothy Polio's Newsmaker Live on Wednesday, April 18th, 2018, that the government has taken a decision on the comatose St. Jude Hospital project. In the latest episode of contradictory pronouncements from the UWP government, Senator Mary Isaac stated, and I quote, that this is the position of the government at this point in time, to build a new hospital right next to St. Jude, on the other side, because there is space there. And I hear people talking about building it all over the world and whatever. Just on the other side of the road, because there is a lot of land on that side of the road. We don't want to destroy the structure that they have already started. We will complete that structure, build it into a medical school, unquote. And that is what the Minister for Health told the nation through Timothy Polio's Newsmaker Live program. We condemn this plan and continue to appeal to the government to do what is right for the people of the South and indeed for the country. We call on the government to give priority to the health needs of the people and cease playing games with the St. Jude Hospital rehabilitation or reconstruction project. If they will not heed the call of the opposition, at least be sensitive to the following grave concerns expressed by the St. Lucia Medical and Dental Association, SLMDA. And again I quote from the SLMDA. These deplorable circumstances in which we are expected to deliver healthcare services to the public accounts for the poor quality of our healthcare delivery outcomes and increasing numbers of unwarranted deaths, all continuing to spiral out of control, unquote. I wish to repeat what the professionals, the doctors, the St. Lucia Medical and Dental Association, I wish to repeat what they said. And I quote, these deplorable circumstances in which we are expected to deliver healthcare services to the public accounts for the poor quality of our healthcare delivery outcomes and increasing numbers of unwarranted deaths, all continuing to spiral out of control, unquote. These are the words of medical professionals. How long will it be before a friend or member of your family becomes victim to those circumstances? The UWP's excuse is that the Labour government did not complete the hospital after 4.5 years in office. True, the hospital was not completed. But at no time did we stop the hospital reconstruction to play political games. We kept seeking money to put into the completion. Work was never stopped on the hospital. This is how responsible governments operate. In 2 months' time, it will be 2 years since this government has been in office. It will also be 2 years of the government not doing enough or anything about bringing the hospital to completion. Nothing except making contradictory and threatening statements, promising to make some people pay. In his budget presentation mere weeks ago, the Prime Minister indicated that there was no decision on the St. Jude Hospital reconstruction project. Just prior to the Prime Minister's statement, Minister Guy Joseph, Minister for Economic Affairs, indicated that there will be a new hospital constructed and sited in an area next to the Heineken Brewery. Then there are statements that were made by the same Minister for Economic Affairs earlier that indicated a possible 6-month completion period for the St. Jude Hospital project. At last Wednesday's interview on Timothy Polio's program, Minister Mary Isaac said it will take about 2 years. While all this confusion continues, people's lives are being placed in jeopardy. No reference has been made by the government to the handover report called the St. Jude Reconstruction Project Handover Report. For example, 1. The report states on page 15 that 98,451,346.85 was spent up to July 31st, 2016, not the 170 million stated by Minister Mary Isaac. Page 18 states the issues, challenges, and constraints, including change in policy direction in August of 2011, financing challenges, and the steps that were taken to resolve those financing challenges. 3. Page 21 states that the consultant, Halco Group Limited, also collaborated with Accreditation Canada to support the architectural reviews to feed into the hospital layout and final designs. 4. Page 23 of the report refers to the accreditation process initiation, where a decision was taken to work with Accreditation Canada once the hospital transfer had taken place. And page 26 refers to outstanding issues for action. All of that can be found in the St. Jude Hospital Reconstruction Project Handover Report. It was hidden by the ministers, by the UWP government, and it was the leader of the opposition who made it a document of the House under much stress and pressure by the government. But it is now a document of the House and can be accessed by the public so that you can read for yourself what the project manager left for the government. So there is a clear pattern of misinformation by the government, and it is our considered opinion that it is a deliberate attempt to confuse St. Lucians. The decision to put the St. Jude and Owen King EU hospitals into the ownership of foreign-owned private companies follows a pattern of behavior in which foreigners for profit and close friends of the government are sought out for the ownership of our public health assets and institutions. This behavior is both distasteful and arrogant and creates the platform for open and blatant corruption. There has been no announcement of competitive bidding for the management of the Owen King EU Hospital. The government only responded to the questions about privatization of the Owen King EU Hospital after the exposure of irrefutable information by the leader of the opposition. The government continues to ignore all advice, even that of our medical professionals and qualified engineers, on the continuation of the St. Jude Reconstruction Project. Instead, surrogates of the government are being allowed to visit the hospital site and to measure with their arms and their bodies and to provide uninformed commentary on the physical and technical structures in the hospital. How shameful. This United Workers' Party government has now turned our St. Jude Hospital Reconstruction Project into a mockery for the purposes of benefiting foreign friends. The health minister now refers to the St. Jude Hospital as that thing. That thing. She repeated this several times in her interview with Timothy Poleon. Ministers of the government continuously announce different decisions on the fate of the project. Our party had one intention and one intention only. It was to complete the St. Jude Hospital and to return it to the patients, staff, and St. Lucian management to the hospital at Auger in Vieux Fort. Although there were regrettable delays due to lack of financing, and all of the issues are in the handover report, we stayed the course through all of those difficult years. We did not complain. We did not play politics after we won the government. We stayed the course and we worked to complete the St. Jude Hospital. The UWP government must stop the deliberate attempts to hand over our hospitals to foreigners. We join with the voices, and the voice of all St. Lucians, asking for good sense to prevail. We urge the government of the United Workers' Party to listen to the doctors and the nurses and the qualified engineers and all those who are pleading and begging kama de souple pour fini l'hôpital St. Jude. Tout moun ka plaider, yo ka plewe. Se docteur and medical association ka di ki moun ka mort parce que condition l'hôpital là en stadium là pas bon. Si docteur ka di moun ka mort parce que condition pas bon, pour qui ça gouvernement United Workers Party vle chen se moun en stadium là pour l'autre 2 ans, en l'autre 2 l'année parce que yo pas vle fini l'hôpital là. Nous avons plaidé avec le gouvernement. Quand le leader opposition a dit, honorable Philippe J. Pierre dit, nous avons mené tout le monde ensemble pour assurer le gouvernement tant en voie qui fort, qui nous pas qu'à accepter pour le gouvernement bailler l'hôpital nous, bailler gens l'autre pays parce qu'ils veulent faire profit et parce qu'ils veulent faire l'argent. Tout le monde mettait l'argent by St. Jude. En constituency même, Belleville Development Committee, en toute constituency, maman l'école, Van Cycle, moun fouye la meyo en la glace pour bailler l'argent pour vieux oui bâti l'hôpital St. Jude. Ingénieur qui a dit l'hôpital là ça vieux oui bâti. Ministre là même dit qu'il prend 6 mois pour finir l'hôpital là. À présent, yo vle bailler l'hôpital là pour gens l'autre pays pour yo faire profit et ministre Mary Isaac a dit yo kay faire un medical school avec l'hôpital St. Jude. Frère que Jean Media, tout gens cette ici, nous partons bailler l'argent nous pour pièces gens l'autre pays viennent faire medical school à l'hôpital St. Jude. So the St. Lucia Labour Party stands with the people of St. Lucia and demands that the government work speedily to complete the St. Jude Hospital reconstruction project. I thank you very much.